question dovetails on this gentleman up there. My insurance is employer benefit, and they place similar percentage that he said he does for his employees. And they have indicated that they will drop our benefits if a public option comes available. It's a major employer in the Midwest. So like right now, our total family premium is a little over $800, and our percentage of that, like I say, is a little over $200. So when we go to the public option, and President Obama does say people could possibly see a reduction in their premiums, and I know about the insurance exchange and all of that, but a reduction in my premiums then could potentially mean for me, say $750, which would be a triple of what I'm paying now and more. And that does affect 88 million people, like the gentleman said. It's the middle class. It's the people that you run on. And I'd just like to know how you can explain that to us. I know about the subsidies coming back, they're income related, all that kind of stuff. I just think there's a lot of questions unanswered for most of us in the middle.
Great. Thank you, ma'am.
Ma'am, I'm having a really hard time understanding why your employer would tell you they would drop your insurance coverage just because the public health insurance option was available.
Answer my question from there then, if you could please, because that's probably what will happen. So premium-wise, like I say, I could end up paying, triple or more than I do now.
Right now, healthcare costs have tripled in the last 5 years under private health insurance plans. And one of the things we know is that private health insurance companies are doing pretty well right now. And one of the reasons they're doing pretty well is because the percentage of their premium revenues they're devoting to payment for medical care gets smaller and smaller as they return more and more profits to their shareholders. And for those of you who've been in Iowa as long as I have, we've seen a huge change in the insurance industry. Because it used to be most of these companies were mutual companies. They were owned by their policyholders and their responsibilities were just to their policyholders. But we've seen those companies switch from mutual companies to stock companies that have a responsibility to return profits to their shareholders. And that's why in Iowa we have 80% of the health insurance provided by 2 companies, one of whom is United Healthcare. And they have earned an average of $3 billion of profit in the last 5 years. Their CEO, who makes $14 million a year, has $744 million in unexercised stock options. And he exercised stock options of $127 million this year. And he was required to return $190 million in stock options that he required as a result of practices the Securities and Exchange Commission found were fraudulent. So the reason I asked you the question I did is because if your employer has more choices and more competition and more transparency in the exchange, I would think that would give them more incentive to shop for a better deal and find you the best possible policy and every other employee who works there. So I just am at a loss at how putting a public option in place is going to cause employers to dump their coverage.
Great, thank you.